Welcome to today's episode. We're discussing a vital topic, public health access in South Sudan, especially how improving affordability and expanding rural services could change lives.
Absolutely. And honestly, it's such a crucial conversation. Right now, many citizens are forced to travel outside South Sudan just to get basic medical care, which is both risky and expensive. Exactly. Imagine having to cross borders for a simple checkup. If the government increases free access to healthcare and builds rural clinics, people can get treated early, saving both lives and costs. And it's not just about saving money. Early interventions prevent minor health issues from turning into deadly emergencies. A fever today shouldn't become a tragedy tomorrow because the nearest clinic is days away, right? Plus, investing in local healthcare infrastructure could create jobs. Hiring doctors and specialists, even from outside South Sudan at first, could be a game changer. That's a good point. Bringing in experts could also help with knowledge transfer, training local professionals, building stronger systems from the inside out. It's almost like planting seeds. At first, you might need help watering them, but over time, those systems grow roots, and South Sudan would have its own robust healthcare network. Totally. And think about the psychological aspect too. Having care close to home reduces stress for patients and their families. You heal better when you feel safe and supported. Not to mention, rural clinics could double as public health education centers. Teaching communities about hygiene, nutrition, and disease prevention could dramatically lower illness rates. Exactly. Prevention is way cheaper than treatment. Simple education can prevent outbreaks of diseases like cholera or malaria that otherwise devastate entire communities. And there's also an economic ripple effect. Healthier citizens are more productive. They can work, attend school, and contribute to rebuilding the nation. Absolutely. It's like strengthening the foundation of a house. If the people are healthy, the whole country becomes more stable and prosperous. Another thing to highlight is home health care. For people with chronic illnesses or disabilities, receiving care at home can be life-changing. Definitely. It saves families from endless hospital trips, reduces the burden on clinics, and ensures people get personalized, consistent care. Plus, home healthcare is usually cheaper than hospital stays. In countries with limited hospital beds, this approach frees up space for emergency cases. And you build stronger community bonds. Nurses or health workers visiting homes create trust, which is essential for ongoing public health initiatives. It's like creating a safety net. Even in the most remote areas, people wouldn't feel abandoned or invisible anymore. And once the basic healthcare needs are met, South Sudan could invest in specialized services like mental health support or advanced diagnostics, which are often overlooked but so needed. That's such an important point. Mental health, for example, is critical, especially in a country that's faced conflict and trauma for so long. Building local capacity, from primary care to specialties, means that future generations won't have to look elsewhere for basic human needs. Exactly. It's about dignity. Healthcare is a human right, and by investing now, South Sudan can lay the foundation for a healthier, stronger nation. So true. Improving public health access isn't just a medical issue, it's a national development strategy. Well said. And hopefully, with enough focus and effort, we'll see a future where no South Sudanese has to leave their homeland to receive the care they deserve. Here's to hoping for that brighter future. Thanks for tuning in, and we'll see you next time. Please follow Majok Wuchok on Facebook and subscribe to Make Talks YouTube channel.